This is Diane Phillips, and this is my voice thread for Pharmacology 601. I chose to review a commercial for Pradaxa as an option for patients with non-valvular AFib because my almost 50-year-old brother recently suffered a stroke related to his AFib heart condition. He was started on warfarin therapy to treat the occurrence and prevent further incidents. I'd heard about the new medication Pradaxa and wanted to see if this new medication could offer possible benefits over the warfarin that he was prescribed. The commercial I viewed was short, sweet, and to the point. It opened with a pretty actress portraying a physician at her desk with a white lab coat and a shiny stethoscope hung loosely across her shoulders. Sitting across the desk with his back toward the viewers was another actor portraying the patient. There's no conversation with the patient as the doctor looked past the patient into the camera and stated that Pradaxa is a new medication that is indicated for her patients with AFib and that it is much better because taking it no longer requires that her patients come in for frequent blood testing required by the old medication warfarin. She smiles hugely into the camera and says that when she finds something that is better and easier for her patients to take, she prescribes it. In the background, a bit of music plays while almost inaudible precautions are vocalized while they flow in rapid sequence in tiny letters across the bottom of the screen for approximately 10 seconds. The commercial then ends. After viewing the commercial, I located the 18-page insert for providers and the 6-page medication guide for patients online. The insert for providers does include the information that there is no antidote for reversing possible severe bleeding related to Pradaxa. However, the patient medication guide does not include this information. However, the patient guide does emphasize the urgent need to contact the physician if uncontrollable or unusual bleeding occurs. I wonder what the doctor will actually do for a patient who has the adverse reaction of severe bleeding. I'm not a particular fan of pharmaceutical companies bypassing the provider to entice patients and consumers to ask for their specific drug cure. It is definitely a financial boon for these companies to be allowed to advertise directly to the benefactor of their product. The pressure the consumer might exert on the practitioner is intended result of this direct marketing approach. Something about this style of salesmanship seems a bit like the old-fashioned hawkers promising cures on the street corners of yesteryear. True, we are a bit more sophisticated and tech-savvy than those old-time merchants, but are we any wiser? When a patient approaches the provider about a medication they saw advertised on the television or other media, how should the provider respond? First of all, it's important to ask the right questions without insulting the patient or their concerns. A good place to begin is to ask where they heard about the medication they're requesting. Asking why they want to try the medication will likely be an exercise in futility and bring about a litany of quotes from the commercial. It is also important not to diminish the patient's apparent concerns and reasons for wanting to try a medication promising better results. If the provider is not familiar with the requested medication, the decision to try it should be delayed until it can be researched by the physician or provider. Then the provider needs to do the research. In the case of my chosen commercial, Pradaxa is the medication to be explored for possible patient use related to the intended pharmacotherapy. The opportunity for patient education and better understanding may be one positive that such a patient request if presented appropriately. Now let's look at Pradaxa. Pradaxa is a direct thrombin inhibitor. In the United States, this new drug is approved for thromboembolism prevention in non-valvular AFib. It claims the clinical benefit of preventing about 5 more strokes per thousand per year than warfarin. It also boasts a lower rate of hemorrhagic and ischemic stroke, but the information material does admit a higher rate of major GI bleed, which makes the product comparable to warfarin. One negative that Pradaxa it has no specific antidote. It does cause gastrointestinal symptoms, and 10% of in 10% of patients. Benefits of extended use may not outweigh risk to patients with high bleeding risk. The cost is another hurdle to cross. A 30-day supply costs approximately $290. This medication does not require frequent blood tests according to the commercials. On the other hand, let's look at warfarin. Warfarin is approved for prevention treatment of venous thrombosis, PE, thromboembolism due to AFib, or prosthetic heart valve and secondary prevention post-MI. Its main clinical benefits are prevention of stroke related to AFib, post-MI reduction of reinfarction, stroke, and mortality. Warfarin does have vitamin K as a specific antidote to reverse dose-related bleeding. It also requires INR monitoring with blood tests at least every 4 weeks. Warfarin is the preferred anticoagulant for AFib with CAD. Foods containing high levels of vitamin K are counterindicated when taking this anticoagulant. The approximate cost for this drug's 30-day supply is about $4. Proponents of the new medication Pradaxa say the cost-effective analysis shows that even though Pradaxa is more expensive than warfarin, it is cost-effective because it gives more benefits for that increased cost. Unfortunately, the studies referenced were not based on real-life models, but rather on hypothetical cases in ideal situations. Blood thinners are prescribed to individuals with heart or blood disease where the blood will not flow well to the brain. Those patients with AFib are at higher risk for stroke than other patients. Warfarin is an anticoagulant. Pradaxa, the new kid on the block, is an anticoagulant and a thrombin inhibitor. Both warfarin and Pradaxa should reduce clotting but not stop it completely. Pradaxa is only approved for non-valvular AFib, while warfarin is approved for treatment and prevention of several other health issues in addition to AFib. The other selling point espoused by the manufacturers of Pradaxa is that there is no need for regular scheduled blood monitoring. This proposed convenience is one of the biggest selling points for the patient. However, this claim was recently contradicted by the British Medical Journal, when it reported that studies were withheld by the manufacturer which showed that the manufacturer knew that monitoring blood levels in patients would reduce the risk of serious bleeding. The British Medical Journal also asserts that Pradaxa would have lost its marketing advantage if this part of the study had been made public prior to public introduction and advertisement. As a provider and a patient educator, it's important to think about the following. Pradaxa is a current new option for patients with non-valvular AFib, but apparently comes with some other consideration. It is not more effective at preventing strokes than warfarin. It does not require blood testing by a physician. However, the company's own data reveals that being monitored could decrease the risk of severe bleeding complications. With warfarin and Pradaxa, bleeding may occur. With Pradaxa, the most serious bleeding includes gastrointestinal bleeding and bleeding on the brain, both of which are life-threatening. There is no known medicine or substance known to reverse excess bleeding due to the use of Pradaxa, while vitamin K reverses warfarin. A provider should be educated about current trends in the media and other sources regarding advertised prescription medication. The provider should be willing to and able to use inevitable patient medication requests as an opportunity to acquire knowledge and to provide education to patients under the provider's care and trust.